Hello everyone, my name is Dr. Drut, and in today's video we're going to show how to activate expander. So this is the key, and you will be given a key, and make sure you follow the doctor recommendations. For example, sometimes we tell to expand once a day, sometimes every other day, sometimes twice a day. So remember, everyone is different and you have to follow doctor's recommendations on expansion. What are some of the concerns that usually our clients ask? Some pressure, it's normal. It takes time to adjust to expander. So if your child experiences some pressure, it's absolutely normal. Sometimes you see the gaps in between the front teeth. It's also absolutely normal, and the gaps will be closed. Remember, this is not a concern and expected. It takes a few days to adjust to expander. When expander is inserted, sometimes you have speech difficulties, which is normal, and usually those difficulties will be gone in a couple of days. So now what we're going to show you how to activate the RME. So this way you should not have any questions about watching this after watching this video, okay?
Hi, my name is Jennifer and I'm a certified dental assistant at Diamond Braces. Today I'm going to show you how to properly turn an expander using the key. Okay. Open big, 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 big. So you'll want to insert the key into the hole here. Make sure that the key is all the way in. You should be able to wiggle it like this without it moving. Going to push the key down towards the throat until you see the next hole visible. Okay, at this point you'll remove the key and you should be able to see the next hole. Be careful that when you're removing the key not to pull it back up. After the turning, it will look like this. You will see this next hole. Okay, it's normal that the patient will feel pressure during this. That's normal and that's expected. But if there are any questions or concerns, please just contact us. Thank you for watching.